Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
Episiotomy and perineal tears are the two words that give most pregnant women anxiety about the vaginal childbirth that they're about to experience. I'm here to be the voice of medical reason and to let you know how vaginal tears are graded, factors that can cause a change in vaginal elasticity, and how quickly your vagina will heal. And of course, 4 exercises to shrink your vagina back to normal and make it snap back in today's Pregnancy Pukeology Podcast, episode 35, Episiotomy versus Perineal Tears, what you need to know about the aftermath of a vaginal delivery. Want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, or headaches now. Or just place No More Nausea Band on your baby registry for your delivery bag at Bye Bye Baby, or get it shipped for free in just 2 days on Amazon as a Prime vendor. And know that your little ones are always taken care of at your local CVS store, which contains No More Nausea Kids and No More Sleepless Nights. Because, let's face it, during COVID-19 times, we all want our kids to sleep through the night. So let No More Sleepless Nights help all of us and the family. Do you want to hear hilarious pregnancy humor that may just make you want to pee your pants? Like you don't have to pee all the time, with crazy stories like fun run or no fun, to tube or not to tube, and salty secretions. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive. And just know we're in this together. Today, you'll learn the truth behind your vagina after a baby comes out, the different types of perineal tears versus the episiotomy and potential complications. This podcast will also give you the answers to crazy questions like, will I get stretched out down there? What could happen to my vagina during vaginal childbirth? And is there anything that I can do to get it back to the vagina that I once had? Of course, ending the podcast on 4 ways to tighten your vagina so no one ever knows that you've had a child. Coming up, all in today's Pregnancy Pukeology Podcast, episode 35, Episiotomy and Perineal Tears, what you need to know after a vaginal delivery.
The science of puke, Pukeology.
Will I get stretched out down there? I hear it from my patients all the time. So don't worry, ladies, you are not in the minority. The majority of women believe that to have a tight vagina improves your sexual performance. And some women even fear that getting pregnant will end up avoiding this fear. Will I be loose after I have a baby? The truth is, the tightness of your vagina doesn't actually change your sexual performance. Another fact is that you will be stretched out down there after giving birth vaginally, but your vagina will get back to its pre-birth size a few days after birth. Let me repeat that. Your vagina will be back to its normal size just a few days after. The vagina is made up of distensible muscle tissue, meaning that it stretches when it needs to during sex or when having a baby, and then it will gradually go back to normal when the stretching force is removed. Just think of a rubber band. It stretches but goes back to its original form. However, your vagina may remain slightly wider than normal if you give birth to a very large baby or have multiple deliveries. So, how can you even tell if you're stretched out down there? Do the tampon test. A regular tampon can help you tell whether your vagina is slightly wider or not on the inside. A pre-birth vagina is able to hold a tampon when inserted down there, but a slightly wider, again, will not, and the tampon will end up sliding out over time. The good news is that you can quickly get your vagina back to normal with Kegel exercises. When done correctly during and after pregnancy, 3 times a day for 5 minutes, Kegel exercises can actually tighten everything up down there very quickly. We'll talk more about that in the tips and tricks section. Your vagina and your uvula will actually be a different color. Again, your lips, your vulva, and your vagina will actually be different colors before and after birth due to changes in pregnancy hormones. Estrogen and progesterone hormones are high during pregnancy as a result of blood flow. This will then change the shape and the color, which could potentially disappear gradually after birth when all of those hormones are let out. Giving birth also makes your vagina very sore. And by the way, even if you have a C-section, you will still bleed down there just in the same amount as a woman who has had a vaginal delivery. So keep that in mind. You will have to use those big, gigantic pamper diaper-like things after birth because you both will be bleeding, regardless if you have a vaginal or a C-section delivery. A sore vagina is normal after a vaginal birth. This has been associated with tearing and bruising of the vagina during childbirth. According to the American College of Obstetrics and Gynecology, 53% or more of vaginal deliveries cause tearing around the birth canal. You will feel sore, but it is dependent upon the varying severity of the tears. Healing usually takes around 4 to 12 weeks. If, however, you experience a significant tear at your vagina during the perineum, during birth, it will have to be stitched by your physician. And again, you may have to have surgery thereafter to repair to put everything back to normal. So let's talk about perineal tears. Lacerations of the perineum, the area between the vagina and the anus during childbirth, is called a perineal tear. Just break the word down into two. The risk of vaginal tearing is high if you are overweight, if you are giving birth for the first time, if you have a super fast birth, and if you get assisted vaginal delivery, like the use of a vacuum or forceps, or malpresentation of the baby if the baby is face up instead of face down like they're supposed to be. Sometimes a cut may be made in your perineum and your vaginal wall when giving birth. If the cut is made by your healthcare provider, such as an OBGYN, your doctor, this is called an episiotomy. Why? Because the word otomy means to cut. You are cutting that perineum so that the baby can come out easier. The difference between a tear and an episiotomy is that a tear is your body's natural response if something too big is trying to come out of something too small. It tears. But if you have a nice clean cut, such as an episiotomy, it allows the baby to come out without any forceful rip and tear. That's the difference. Remember that an episiotomy is done to increase the space for your baby's passage in its way out of the vagina. This happens when the baby is born too fast, if instrumentation is used during the birth, like we talked about with vacuums or forceps. Sometimes they just need more room to work. And if you are at high risk for a severe perineal tear, your doctor may just say, you know what, let's tear it. But most physicians will sit there and actually massage the vagina and really push downward to keep opening it as the head and then the shoulders come out. This is what we call a vaginal massage. It's when they're placing their palm of their hand inside of the vagina and really pushing and moving it, allowing those elastic tissues and fibers to be able to fire and relax and elastically open more for the baby to come out. There are 4 different types, or what we call degrees, of perineal tears that can exist, and they range from a simple laceration of the vaginal wall to a very complex tear that involves the wall of the rectum. The first degree perineal tear is the least severe, so again, you want a first degree. The first degree, again, is a laceration of the vagina, including the lining of the actual vagina as It does not involve the vaginal muscle, and therefore no stitches are required. Recovery is fast and relatively simple. You will experience mild pain in the first 1 week after delivery when you cough, sneeze, sit up, or have a bowel movement, just because of the fact that your vagina is a little cut. Think of it like little paper cuts inside your vagina. Ooh, ouch. Second degree, it's getting a little worse, is a cut through the vaginal lining that extends to the submucosa, which is deep tissues of the vagina. These are the most common types of vaginal tears, which require stitches. The recovery period is also long, and you will experience moderate pain whenever you do something that increases pressure down there, such as coughing or having a bowel movement. Third-degree tears. Unlike the first two, a third-degree vaginal tears are deeper cuts in the extent from the vagina to the muscles that make up the anal sphincter. They are complex to repair as each layer is stitched separately. The pain you may experience during the repair may warrant the use of anesthesia. After the repair, you will continue experiencing pain 2 to 3 weeks, and the recovery could also take longer to recover than that because you're not just dealing with just the vagina, but you're going right up into that anal sphincter. Your anal sphincter is where you take a dump, FYI. Fourth degree perineal tear is the worst perineal laceration that you can experience while giving birth. The tear extends through the lining of the rectum. Again, through the least common, fourth degree tears are very delicate and difficult to repair. You will be taken to the operating room there while multiple layers have to be closed. So you will actually have anesthesia for this. Now remember, perineal tears don't always happen. I had 1 vaginal birth and 1 cesarean section. My vaginal birth for my son was 5 pounds, 7 ounces at birth, and believe it or not, I didn't tear at all, and it was a pretty quick actual delivery. So again, you don't have to have a vaginal tear, and I can tell you a wonderful story. I was up and about making dinner for my family within 2 days after giving birth. I felt great. I felt fine. A little sore down there, especially whenever I went to go pee. So try to take that big squeegee bottle or get one of those like football squirt Gatorade bottles and really apply nice warm water whenever that you're taking a pee because you're going to be sore. It's like having super rough sex with a gigantic item, and you may be sore for a few days. But again, you do not have to have a perineal tear when you are giving birth vaginally. And I wanted to show you because I am a perfect example of the percentage that did not have any type of tears. So, complications with these perineal tears. Several perineal tears can lead to the following: pelvic floor dysfunction, prolapse, uterine incontinence, and bowel incontinence. So all of those big medical words, pelvic floor dysfunction, meaning the pelvis and all of the muscles, it's basically not as tight as it used to be, and they're not functioning the way that they should because they're super exhausted, those muscles, with the tear. Prolapse, uterine prolapse, just means that the tacking up extent of the uterus is saggy, meaning that the sagginess, the actual uterus goes down. You may start to experience some pain during sex because every time you feel the thud of the penis, it's because of the fact that you could be hitting the actual uterus. Now, you're not coming in contact with the uterus because you have lining that protects it, but that bump, think of it like a boxing where you have one of those little speed bags, you're thumping it every single time with the penis during sex. Uterine incontinence and bowel incontinence just means you can't hold in your pee or your poop, so you may actually have a little bit of pee. I know personally I've had 2 beautiful babies, and every time I go to a trampoline place or I jump up and down on a trampoline, I get some uterine incontinence, especially if I'm jumping really, really hard. Again, I hope that I have a great, strong pelvic floor, and we'll talk about more exercises to help you, but it does happen, ladies. These are the beautiful results of a gorgeous baby. You will have to wait about 6 weeks to have sex. So how long will it take for your vagina to heal and resume normal sexual intercourse following a perineal tear depends upon the severity of the factors, such as the types of degrees, and we all said first is the best and fourth is the worst. You also have, your diet, other compliance with different medications that you could be potentially on, personal hygiene, amongst other factors. However, the average period of time of recovery to resume sexual activity is about 6 to 12 weeks. Your healthcare provider can give you a better sense of how quickly you can resume sexual activity. Now, if your healthcare provider prescribes you antibiotics to prevent infections, analgesics, which is pain medicine to relieve the pain, stool softeners to prevent excess pressure while having a bowel movement, you'll also be required to avoid anything that increases the pressure down there. I would highly recommend for all women who have a vaginal delivery, regardless if you had a tear or not, take a stool softener, take some sort of pain medication like a Tylenol, something like that, because going to the bathroom, number 2, the very first time is going to be painful. Telling you from personal experience, make sure that you do not have any constipation issues at all. Now, to get your vagina tight again, that will require a little bit of practice and Kegel muscles and exercise, as mentioned earlier, which we'll talk about in the tips and tricks. But again, you may feel a little bit of discomfort at first when having sex, but with time, the discomfort will disappear and you will get back to normal again, just like you were, snapping back that vagina one vajayjay at a time.
Throwing up on a Tuesday? One puke story.
Let's just say my first fun run was no fun. I'm an avid runner, and I found out that I was about 12 weeks pregnant whenever I decided and had already paid for this fun run. It was really fun with a bunch of inflatables, and I've never really had an issue doing a 5K. So I start out running with my husband, and it was great. And then all of a sudden there was a big line. Now it was very hot outside. So all I know is that I started feeling a little faint. I thought maybe I needed some water. I decided to stop and get water. And as these nice people with their children were sitting there passing out water, I uncontrollably started vomiting all over the sidelines. All of the runners and their families were all like, ooh, they thought I had something wrong, that I was getting heat stroke, but it was really that I was pregnant. Thanks, my beautiful little girl, for giving me an experience that I'll never forget. Dawn12, Athena Eris, thank you so much for that hilarious puke story. To tube or not to tube? That is the question. I'm a first-time mom, and I didn't know if YouTube was the way to go. I was in my 3rd trimester, and I was scared about having a vaginal delivery. So I decided to type in vaginal delivery on YouTube. By the way, if you've never done it, please don't do it, just in case you, like me, have a very sensitive, weak stomach during pregnancy. All of a sudden, I started watching the head. All of a sudden, I saw hair, and it looked like an alien was coming out of this poor woman. The vagina stretched so much, and I heard her scream. It was like a real-life horror story. The second that I saw the shoulder come out, I started vomiting all over the carpet. When my husband came home, he's like, why does it smell like Clorox bleach? I said, I decided to look at the vagina videos. There's nothing in the world that I could ever do. I just felt super sick. Thank you so much, Stacy with a K, for that hilarious puke story. I must say, sometimes knowledge gives you a little scary. Don't use a mirror if you're that person. Salty secretions. No one ever told me that when you're having a baby, your vagina will smell different, and the stuff that comes out of it is just not right. All I know is that I had the worst cramps in my feet, and I decided that I was going to smell what looked like Charlotte Webb sneezing inside of my underwear. And when I did that, the only thing that I knew that I could do was just barf. I felt the texture and consistency, and I actually threw up inside of my own panties because of how disgusting. It was like a sticky spider web. I'm so sorry, guys. I can't even finish the rest of this story. I must say, Minerva, that is the best puke story ever. Not only did you have a spider web in your pants, but you also had a little make it rain of puke all in it. Thanks again for your hilarious puke story. If you have a puke story that you can't help but giggle and laugh at about your pregnancy experience, share it with me. Send it to me, pukeology@nomonausea.com, or tweet us at Pukeology so we can all have a good laugh.
Tips and tricks to stop the up chuckle that you need.
So you want to know how to get your vagina to snap back in place, and will you have a loose vagina forever? No! These are 5 great ways to help you strengthen your vagina and to get it back to being as wet as it once was. Strengthening your pelvic floor muscles is a way to strengthen the vaginal wall. It is important to know that your pelvic muscles are part of your core that supports your bladder, your rectum, your small intestines, and again, your uterus. With age or after childbirth, your pelvic floor can become weak, leading to accidentally peeing yourself a little bit, constantly feeling the need to pee, which is incontinence, pain in your pelvic area, or experiencing pain during sex. Has this ever happened to you? Well, here are 4 amazing ways to help you strengthen your pelvic floor. Think of these things as exercises for your vagina. Kegel exercises. To find the right muscle, I want you to try to stop peeing midstream. Imagine your baby is crawling and just got into the cleaning cabinet in the bathroom with hazardous chemicals. You know, the one that was baby-proof drawer that your husband broke into because he was enraged that he couldn't actually get into it. And then the one he promised that he was going to fix. Yeah, that one. Can you tell I'm still salty about it? And all of a sudden you see the baby, he's going into your cleaning drawer, and you need to grab him or her before they get into these harsh chemicals in their mouth. So you immediately stop peeing. That are your Kegel muscles. So number 1, for Kegel muscles being done the right way, pick your favorite position for this exercise. Most women prefer lying on their back, but I personally do mine while I'm driving because I have nothing better to do, and I like to time it to the beat of the music. Number 2, tighten your pelvic floor muscles. So squeeze your Kegels for 5 seconds and then relax. Let's try to do that together. You ready? Squeeze your Kegels, 1, 2, 3, 4, 5, and relax them. For 5 seconds, and do it again. So squeeze every time I start talking and relax 5 seconds later. Repeat step 2 for at least 5 times in a row. And just like any other muscle, you'll build up the strength and the more you do it. Increase the length of time from 5 seconds to 10 seconds. Make sure that you are not tightening your thighs, abs, or butt. Only your vaginal floor, meaning your pelvis. For best results, do this vagina workout. It should be done 3 sets a day, 5 times a day. So again, 3 sets of those 5-second squeezes, and then do it 5 to 10 times per day. You will definitely see results within a few weeks, and your husband will appreciate it too, as many will stimulate your sex drive. Pelvic tilt exercises. Doing Kegels is a great way, but again, you need a strength or strong pelvis and core. So this is the pelvic tilt exercise. Stand with your shoulders and butt up against the wall. Put your belly button in towards your spine, with your spine flattening your back against the wall. For ladies who have big booties, also known as sway back, it can be a little harder to actually get your back to touch the wall. As it get as close as you can, and I speak from experience being a Latina myself. I kind of look like a horse, so it's very difficult because my backside is a little bit or a lot bigger than my back, so you really have to try to squeeze it. So you might not actually touch the wall behind you, but try as best you can. Tightening your belly button for 4 seconds, and then release it. Perform this pelvic tilt exercise 10 times for up to 5 times a day. So again, the 4 seconds tighten, that's 1. 4 seconds, that's 2, and so on. Vaginal cones. I get so many questions about this. Vaginal cones are also called Kegel balls. They are weighted tampon-sized objects that you put into your vagina and hold it with no hands. Basically, it's weightlifting for your vagina. If you ever want to waste a bunch of time, since we all have COVID-19 on, this time as a stay-at-home order on our hands, go to the internet and look up Kegel weightlifting or Kegel ball exercises. It's incredible how strong some of these women's vaginas are. The one that comes to mind is a woman that actually holds up a surfboard just with her vagina. I don't think you heard me. Like, she holds up a surfboard just with her vagina. Vaginal cones come in various weights. They usually come in sets of 3 to 4 sizes. The lightest one, and then they get heavier and heavier and heavier. So the first thing is, I want you to try to do these Kegel ball exercises by inserting the lightest cone into your vagina. Try to insert this in without lube because, again, you're going to hold it in there and lube can only make it slip out. And I guess it would help you to really tighten it even more. Squeeze your vaginal muscles and hold it in place for about 15 minutes twice a day. Increase the weight of the cone as you become more and more successful at holding it into place. Challenge yourself by actually trying to do a ballerina squat, which means toes out, and a nice plie. Keep squeezing it to help it stay in place once you've maxed out your weights. And I will tell you that the actual vaginal cones do come in a pack, and some actually come with a vibration, so that not only will you get a little bit more of an electrical stimuli, and we're going to talk about that next, but it also can give you a little bit of a hey, how you doing? Excitement factor for sex, maybe later. Neuromuscular electrical stimulation, also an acronym, is NMES device. Most people have heard of a TENS unit. They use them for, back pain and stuff like that, and or some people use them as a waist trainer for their abs whenever it literally zaps you and all of a sudden your muscles end up contracting. But most people don't think about a TENS unit down there. Well, let me just tell you the way that a muscle actually contracts. So it contracts sending an electrical signal through the body that innervates the muscle, and that changes the electrolyte components on the inside of your body, which causes your muscle to obviously form a tight contraction. The NMES device, electrical stimulatory device, is no different, but the signal instead is not coming from the body, but from an outer source. So a vaginal probe is inserted into the vagina that sends electrical stimulation, causing the pelvic floor muscles to contract and relax. The session usually lasts about 20 minutes, usually done inside of a doctor's office, or it can be prescribed at home use, but you should do this for about 20 minutes once every 4 days. Again, 20 minutes once every 4 days, and you can increase the intensity as you go about your different sessions. Will your vagina change over time? Yes, and there's only 2 real factors that can affect how tight you are down there. The vagina's elasticity is dependent upon age and childbirth. Frequent sex or lack thereof won't cause your vagina to loose or get tighter of any type because, again, it's made up of stretch receptors. Women who have had more than one vaginal birth are likely to have weakened vagina muscles due to the stretch needed to make your baby pass through the birth canal. It is normal to feel that your vagina is slightly looser after vaginal delivery, but your vagina will snap back into place a few days postpartum. It may not return to its original shape due to suturing, also called stitching, by your doctor, or the internal tears causing your muscles to get larger on one side or the other. Remember, your vagina is full of muscle, and it's no different than any other tear of a muscle as your body part down there. So think of it as a protective mechanism, making the surrounding muscles even stronger, and you may even pull a muscle on the other side. Have you ever heard of a person who pulls their hamstring on one side and then the other side starts to hurt because they are compensating the way that they walk? Believe it or not, the non-affected side of your vagina or the lips may actually get larger by doing more work. Your vagina is in the exact same way. The labia or the lips, again, may get a little larger after birth just because of the fact that they're really having to pull in tighter than they once were. And this is, of course, after your baby is born. Now, the vaginal elasticity, not electricity, but your vagina is very electric. Your vagina's elasticity decreases as you get into your 40s. So all of us ladies who are pushing that 40 mark, as you become perimenopausal, our estrogen levels start to drop, meaning that the vaginal tissue becomes thinner, drier, less acidic, and less elastic and or flexible. All of these reasons make you feel like your vagina is looser than before. And all of you ladies who had babies later on in life and that are getting close to menopause itself, believe it or not, it will get worse. So how to increase your vaginal moisture? Vaginal wetness comes from both the Bartholian gland, which is a pea-sized gland located inside the vagina, and the cervix. The cervix produces the mucus and the fluid as a response to hormonal changes in the women's menstrual cycle. This happens during ovulation, hence why you want to have more sex during this time of the month because you're nice and wet. Both produce moisture, both glands produce moisture when the female feels aroused during sexual activity. This vagina wetness should be clear. If it is not, there are many potential reasons and infections may be in question. Curious what color and vaginal smell your vagina currently has? There's a great chart on Pregnancy Pukeology Podcast episode 22 called Vaginal Discharge that shows you what your vagina is trying to communicate with you. Number 1, stay hydrated and drink a lot of water to become wetter. Decrease your intake of caffeine and alcohol because they are natural diuretics, meaning they will deplete your body of water concentration. Number 2, get healthy fats in your diet. Add foods that are rich in soy, flaxseed, and vitamin E, which will help you to restore estrogen hormone levels in your body, thus increasing your vaginal moisture. Come more. You heard me say it. Get excited more. Notice I didn't say have more sex, but if it happens, tell your husband I said you're welcome. You need to stimulate your mind and your vagina to allow yourself to get wet more often. Your body will respond better with practice. If you get turned on by watching the boys of Baywatch, listening to a little Usher, or playing with yourself, there are G-spot shaped toys that will help you speed up the process. Just do it. Now that you know the science behind the vagina after a vaginal delivery, the difference between an episiotomy and the 4 different types of perineal tears, how the vagina snaps back to normal, and ways to get a tight vagina so that no one has ever known you have a baby down there. If you love Pregnancy Pukeology Podcast, let me know with a 5-star like for rating or hearts for likes. Don't forget to download this episode, but more importantly, share it with all your prego friends. Thanks again for listening to Pregnancy Pukeology Podcast, episode 35, Episiotomy versus Perineal Tears, what you need to know after a vaginal delivery.
Pukeology Podcast, edutainment at its finest.